how long it takes, to affect the entire body, in the sense that the patient, the patient is not able to even stand up or talk, or the organs stop to function. How long does it take?
It depends on it depends very much on person to person, because if your
Okay.
body system is naturally very strong, then it will take some time to break that, immune system. So then the progress could be a little slower. But if your immune system is already weakened, let's say if you are having any underlying medical condition, or if it affects very young patients at a higher degree, then the progress could be very rapid. Now, generally, lupus is detected between age 15 to 45, which is a reproductive age, we call it. That's where it's generally identified or diagnosed. These days, it is getting diagnosed at a very early stage. Thankful to the medical advancement, people are a little bit more, vigilant about the symptoms and all. So it's getting even diagnosed at early ages in young child kids, and also in older patients. But again, it's all depend on how stronger your system is, how your system has already to break this immune system.
Okay. And what are the very, very common symptoms of this disease? Because generally, what happens in our system and culture, generally when the kid is getting weak or something, the most common thing a mom or father look for is that the kid is not eating properly. That is the most common. But what are the common symptoms that once the parent sees in a kid, then they should go for a more comprehensive checkup or diagnosis?
It's very good question, and actually it's a little bit complex also. Now, most conditions, like even I'm correlating to cancer because it's as critical as any other autoimmune diseases. The symptoms, early stage symptoms, mimic a lot with the common conditions, like the weakness, not eating, and all this is kind of a common related to any other medical conditions like flu or a bacterial infection, and that is how they are treated and seen in the early stage. So it's really hard to identify, but that is where, if your symptom is if your kid is showing any signs of complaining constantly on a chronic basis of joint pains, weakness, or any particular part of the digestive system is weakened, like either he's indigestion is there, something like that. Anything that is going on a chronic level for like few days to a week, that needs to be taken into consideration of few conditions beyond the acute. So flu and all this are considered acute conditions, bacterial infection acute. But if your condition or symptoms are going beyond few days or weeks, then it has to be seen with the eyes of chronic conditions, which could be like autoimmune diseases. But again, most of the time the doctors have a way of differential diagnosis. In medicine, we do differential diagnosis. So you will present with the symptoms, they will do the differential diagnosis, and once the doctor feel like that it is that he would like to exclude any of the autoimmune condition, he will order the particular test to exclude that in from the diagnosis. And that's from there, the things are like, if they find that particular genes, or if they find that, then from there, the diagnoses are more confirmed by more advanced diagnostic methods.
Okay. So the parent should actually look for these symptoms where, say for example, the fever or weakness or the pain. These common infections are not going for a very, very long period of time. They can go for the more comprehensive diagnosis and treatment. Unfortunately, the treatment as such, there is no cure for this disease now, but the CAR T cell therapy may bring a new life to such kind of a patients.
If you liked the video, then please like, subscribe and hit on the bell icon to receive notifications.